Now we're going to inject the upper lip, vermilion border. We're going to give her a little bit of volume here. Then we'll inject the lower lip, vermilion border, and a little bit of volume. The most important thing we need to do is keep the 2/3, 3/3 ratio. So if we over-inject the upper lip and the ratios change, it's not going to look normal. So I usually pull the lip back a little bit and inject along the vermilion. This is Juvederm that I'm using. Doing okay?
Mm-hmm.
She's had a little topical numbing on. This hurts a little bit. What I'm trying to do is not lose the Cupid's bow. Stretch a little bit. Get right in that space between the pink lip and the skin of the lip. And sometimes, and you can see it here, the product is tracking beyond where my needle is. Once you get in that correct space, it just flows in the right tract. I like to go back once it's a little numb and just finish off the Cupid's bow. I'll do the lower lip. This hurts. She's had topical on. Sometimes if it's too painful, we'll do a dental block. Get a little bit of volume in her upper lip. She's got small lips, so if I overdo it, she's going to get duck lips. Open. It's always important to mold after you put things in. I don't necessarily have the patients mold it, but I can feel if I've missed any areas, and I can smooth things out a little bit as I mold it. Okay, a little volume in the upper lip here. And a little in the lower. So far I've used about a half a syringe. Alright, now we're going to bring the corners of the mouth up with a little X. This is still Juvederm. Again, corners of the mouth with an X. So she has more definition of her lips, a tiny bit more volume there, and the corners of the mouth have come up. If I'm a little concerned that that wasn't enough, sometimes I'll put some Botox in the DAOs. Now with the little bit left over that I have, I'm going to inject her nasolabial folds, just to soften these a little bit. All right, so there's quite a few little smoker's lines here. We have, even though she doesn't smoke, so we're going to treat these with a tiny little bit of Juvederm. Sort of press it into place. I am preferring for smokers' lines now to use either Volbella or Refine, but I can also use a little bit of this Juvederm left over just to treat some of these lines. It's got a little bit higher G prime, so it may be a little lumpy, so that's why I have to press it into position. Occasionally I'll have patients who complain of a little bit of lumpiness, especially in the oral commissures, when they're in the shower, to take, open your mouth a little bit, to take their warm fingers and just sort of press it out into position. And sometimes I'll even do that maneuver while I'm injecting if I feel that it's a little bit lumpy. If I know an area is going to be sore, I'll inject it a little bit and then go back and inject it again once the numbing is kicked in.